From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Thank you very much for tuning to our channel today. Today I want to talk a few minutes about febrile seizures. Febrile seizures, basically they are defined by a few criteria. They occur between 3 months and 5 years of age, even though that varies. Always they will have a fever more than 38.8 degrees Celsius. And they are of non-CNS infection. So those are the 3 criteria to define febrile seizures. And most of the times they last less than 5 minutes. They occur early in the illness causing the fever. And febrile seizures, they occur in 2 to 3% of children. So if you are a primary care physician, you will definitely see these patients either in emergency room or somewhere else. Most commonly gastroenteritis, especially by Shigella or Campylobacter, or urinary tract infections. And even infections like Roseola infantum, that's a classic cause of this condition. And imagine what are the most common things that cause fever in children? Viruses. So viruses, they account for 88% of febrile seizures. So they cause fever, the temperature goes up and children get these seizures. And many of them get recurrent febrile seizures. And the likelihood of getting epilepsy is less, thankfully. But the parents, they get very, very anxious when they see their children having a seizure. So it's the most important part of the treatment is to reassure the parents. Now, there are simple seizures and complex seizures. Simple seizures and complex seizures, I will tell you the differences. Complex seizure is something that is associated with focal problems, or it lasts like more than 15 minutes. Or it will leave some residual problems. And many times these children will have a family history of epilepsy. And thankfully, even with these adverse risk factors, even with the recurrence of febrile seizures, only 15 to 20% of children will have epilepsy in the future. So that's so 80% of children, they are saved. So that's a good point when we think about it. So febrile seizures, most of the times they are benign. So that's an important point. Febrile seizures, so they can be simple or complex. So what is a simple febrile seizure? A simple febrile seizure, it's a generalized tonic-clonic seizure, and it is self-limiting, and it lasts only a few minutes. The complex febrile seizure, it's focal in nature. You will see these high-risk things like post-ictal neurological abnormalities. So in complex febrile seizures, you will see post-ictal neurological abnormalities, and they also last more than 15 minutes. So you need to see for these neurological or developmental abnormalities in the history of the child. Is there a history of epilepsy in the family? So simple, the differentiation is very important. The simple febrile seizure, it's benign, it is of short duration, and it leaves the baby or the child with no problems. But the complex seizure, even though it is also not that serious, but it is comparatively more serious than simple. Now, what are you going to do with this baby? When you see a baby or a child with this problem, you should always think of meningitis. Why? Because especially in children less than 18 months of age, you can't rely on physical manifestations of meningitis. Now, when you get these babies, do a CBC and see the WBC count, neutrophil count, and if neutrophils are going up or WBC is high, it is neutrophilia and it is bacteremia. And think of meningitis and encephalitis always. When you see signs like bulging fontanella or stiff neck, or when the baby is stuporous or irritable, when you see those signs, think of meningitis. And in children less than 18 months of age, they don't even have those physical manifestations while having meningitis. So if you see like a 9-month, 10-month-old baby, you should always think of meningitis when they are irritable. And if you are suspicious, always go for lumbar puncture. So when the babies comes with, or children come with febrile seizures, think of these conditions always, because a lumbar puncture, when it is needed, is life-saving. Imagine you missed meningitis, that would be cost the life of the child. So think of a lumbar puncture always. You don't have to do it, but think of meningitis and lumbar puncture. Now coming to treatment, prophylactic anticonvulsants are not recommended after an uncomplicated febrile seizure. So if the febrile seizure happened, all you have to do is to reassure the parents. That's the most difficult aspect of treatment. And most of the times you don't have to give anticonvulsants to these children. All you have to do is to reassure the parents. The fever, when it is gone, this is gone. That's what you should do. Only phenobarbital and valproic acid have demonstrated effectively in preventing febrile seizures. Sometimes parents ask for medications anyway. Start my child in a medication. So in those cases, you should start a medication. And when there is a febrile seizure, it is going on and on like 15 minutes, then you have to control it. The medication that is most commonly used is diazepam. You can also use phenobarbital, but diazepam, that is the most commonly used. You can give it by orally, you can give rectally as a diazepam gel, but that's how you do that. And another medication is valproate sodium, but it is a hazardous medication. Why? Valproate sodium, it causes gastrointestinal upset, it causes hepatic toxicity, it causes thrombocytopenia. So there are these important side effects. So it's better to avoid valproate in these patients and go by phenobarbital or diazepam. Those medications are shown to be effective in managing these patients. But the most important thing is to control the fever. Sometimes antipyretics are all the things you need to do. And what about EEG? EEG usually is normal. When the ideal time is like 1 week from febrile seizures, because if you do it immediately after the seizure, you will get those transient neurological abnormalities over the EEG. So you should always wait for a week before doing an EEG, and that always helps, because EEG most of the times is normal. So don't worry about it, and hope that helps. Basically, febrile seizures, most of the times they are benign, self-limiting. Reassure the parents, and always think about differential diagnosis. Think about meningitis, bacterial infections, urinary tract infections, GI infections when you are treating these patients. And most of the times they are benign, self-limiting. Thank God They don't leave any residual.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you. Are you preparing for USMLE? Please do not waste thousands of dollars on training courses. Get the books written by Dr. Paul with the student-to-student tips and memory aids. The success will be yours, and you will soon realize your dream of becoming a physician in the United States. If you are preparing for Step 2 clinical skills, study USMLE Smasher, a guide helping thousands of medical students to pass this examination. For more information, visit us at www.drpaul.org.